Good afternoon, and thanks for joining us for today's Healthline 3. I'm Johnette Magner. Here we like to focus on ways to live a healthier and happier life. We're going to be taking your calls and answering your questions live in the studio today, and we'll be opening the phone lines. So as a reminder, please make sure that you are in a quiet room when you call. With your TV, we need it turned all the way down. Our number to call, and it's going to appear on the screen many times, 318-219-4569. Let me repeat it, 318-219-4569. Joining us today, I have Jennifer Hable and Nicole Ortiz. Welcome.
Thank you.
And they are with Willis Knighton, and they are total joint coordinators for Willis Knighton Health, and we're going to talk about planning for joint replacements. So it sounds like you have an important job. What if you please start with, what is a total joint coordinator?
Absolutely. A total joint coordinator, really, we focus on two primary things. First is ensuring that our total hip and total knee program runs smoothly and to the high standards of excellence that we have set. And secondly, the biggest thing is really we act as a patient advocate. We're there for our patients from the beginning during that first surgical consultation all the way until it ends. So truly, we're a phone call away the entire total joint replacement experience.
So when we talk about joint replacements, what are the joints that are included in that?
So it's total hips and total knees. That's our main area of focus. It's just hips and knees right now.
And we often need them replaced, don't we?
Yes.
What are the reasons that people need a joint, a hip or knee replacement?
So you have knee pain, osteoarthritis is the main cause of having a knee replacement.
And a hip replacement.
And a hip replacement.
Yeah.
So arthritis is the big one.
Yeah.
Mm-hmm.
So.
A lot of places offer joint replacements. What do you offer that puts you a step above, a cut above the rest?
There are a lot of wonderful programs out there. We at Willis Knighton have taken that extra step to get the advanced certification from the Joint Commission, which is a very fancy way of saying we had an organization outside of ours come review how we do things and make sure that we are meeting the highest standards of care and that we're providing patients with the best care possible.
I used to work for the Joint Commission. They're tough on you guys.
Yes, they are.
Yes, they are. Yes, they are.
Talk about a terrifying thing. It's like,
But it's a really big deal.
It is.
yes,
Yes.
yes,
Yes.
yeah.
So how do you define high quality joint replacement?
High quality is, there are a bunch of moving pieces for a high quality joint replacement. Some things that patients see, some things that patients don't. We are constantly making sure that we're following the latest research that's out there. Are we doing the newest techniques, the ones that have the best outcomes? But our biggest goal is patient outcomes, that they have positive outcomes, and patient experience. That it's, you're having a joint replaced, but we're there with you each step of the way to help make it as easy as it can be.
So how does someone know if they're a candidate for this?
So say someone is having a lot of knee pain. So then you would call your orthopedic doctor. You schedule an appointment with them. You go in and see them. And then you and your orthopedic doctor will go and see how your bone health for your knee is. And then based on the health of your knee, then they would see what kind of measures do we go. Do we go conservative measures all the way through to the last would be your surgical measures to do. So it all just really kind of depends on how well and how healthy is your bone and your joint.
To what degree does weight play a role in needing joint replacement?
It's one of the factors. There are several that weigh into needing a joint replacement. Genetics is absolutely something that we cannot control. That's one big factor. Osteoarthritis is very much a wear and tear disease. So in your knee and in your hip, those are two joints where we're constantly wearing on that cartilage. And so weight, if you're heavier, does, make that wear and tear really happen faster more than anything.
All right, I'd like to remind people that you can call us. Our phone lines are open at 318-219-4569. We'd love to hear from you, and you can ask the questions directly to the experts here. So please give us a call if you have a question. You have what you call pillars of excellence. What does that mean?
It's a big fancy word.
It is a big fancy phrase. I don't have any idea.
Like, what is that? At Willis Knighton, we focus on pillars of excellence, and for this program specifically, patient safety and quality is a big focal point. And there are four measures of performance that we really focus on underneath that pillar. So for a joint replacement, specifically your hip or knee, we're going to focus on how often did we do a regional anesthesia. So that means a spinal anesthetic where you'll be numbed from the waist down. How often do our patients walk? And you walk within 4 hours after a joint replacement, which seems insane.
Yeah, it does.
It seems absolutely crazy. And then also, how many people go home? What percentage of our patients go home as opposed to a rehab facility or something like that? Because now, really, truly, you can go home the day of surgery. You can have your whole joint replaced and go home that day. And lastly, patient outcomes. So in the beginning, we'll measure, are you able to walk stairs? How stiff is your knee or your hip when you wake up in the morning? And then post-operatively, how, can you walk stairs? How are you doing? And so those 4 things are really our focal points, and at both Piermont and Bossier, we exceed the benchmarks set by that scary Joint Commission.
that scary entity.
Yeah.
What is the age where most people start having problems and come see you?
We see a wide range of ages, honestly, but I would say that the median age is around 60 to 70. I mean, we have had patients that are in their 50s and younger, and then we've all, of course, we have some patients that are older than the 60, 70 mark, but really about around 60, probably 65. But I'm telling you, they range. It's a wide range.
And do you see more men or women?
So actually, at at Piermont, we actually see more women that have both their hips or their knees replaced. So it's, but it's mostly women.
Well, and statistically, women have higher rates of osteoarthritis. So it's usually something about like 60% women versus about 40% men is what we see. So.
Do you usually find people that just need one knee or hip, or when they come in, odds are they need both?
It depends.
It depends.
It really depends on the patient. Some people, maybe you had an injury to your knee in high school, and over the years that there's been damage and things like that, and so you need a knee replacement or a hip replacement. But some people have osteoarthritis, and it's not specific to just one knee or one hip, and so some people do become the bionic people with a knee replacement, a hip replacement, maybe a shoulder replacement. So
do you now, if someone needs both knees replaced, do you do them both the same day, or do you do one and then a few months later you come back and do the other? How does that typically work?
So at Piermont, we do one at a time, and generally we'll do the first knee or hip, and then in 6 weeks, usually it's 6 weeks, we'll do the next one. We don't do them at the same time. We don't do bilaterals at the same time.
Does anybody? Not generally?
You can. It really just bilateral hips, no.
Yeah.
Bilateral knees, they will. Some people will have bilateral knees, but it's something that usually pretty athletic can get up and really go, because it's a hard big process for your body to go through.
Especially having both joints replaced at the same time.
Yeah.
One is one thing, but having both of them together, it's a total different.
Yeah.
Do you see, talking about activity, runners more at risk?
They can be,
Yeah.
which seems crazy because you think, I'm doing the
You're
right
healthy.
thing.
I'm
doing the
getting
right
healthy.
thing.
Yeah.
I'm running, I'm exercising, I'm doing what I'm supposed to, but you are wearing away at those joints. I mean, because there's cartilage in between the bone, and when you move them, you're wearing away at that cartilage. So.
And just the pounding, I would
Yeah,
guess is
absolutely.
a big part of it. So if somebody is having joint pain, what would you tell them to do preventively right now to reduce the pain before they actually need to be in surgery? Are there certain steps that you encourage people to take before they take the plunge?
Yeah. So there we do we first do the conservative measures. Physical therapy. Do you need some kind of physical therapy? Do you need injections? We try to look at all of those measures before we take that final plunge and let's go to the operating room. So we try to do the conservative. So I would say your physical therapy, pain injections. Those are our main ones that we try.
And then things like, over-the-counter medications like NSAIDs. Those are really good to help decrease the inflammation. Ice is your friend. We like ice. Ice is a good thing. So little things like that, because a lot of people suffer from joint pain, and it's not comfortable. And so, over-the-counter medications, and then once that, it's almost a progression. You can do over-the-counter medications and ice, and then you progress to, okay, maybe I need some physical therapy, and maybe we've moved past that, I need some injections, and then slowly some progress to needing surgery. So,
what is it that brings people to you? Is it primarily pain?
absolutely.
Yes.
It becomes
Unbearable.
Yeah.
Some people live with the pain for a very long time, and then they finally decide, I guess let's finally do something about it. And then we do have some people that they haven't had pain as long, but majority of people, they've lived with pain for quite a while before they decide to take the plunge.
And it's just slowly progressed, and the NSAIDs and things like that just no longer
just stopped
don't
working.
Yeah.
You can get pain injections, every 3 months, and then, you keep doing that for so long, and then you finally are like, okay, enough's enough. Let's talk about having the joint replaced.
Well, and beyond pain, some people start to experience issues with mobility. Before, you could just walk. Well, now sometimes my knee will give out. It's not as strong as it used to be. It just kind of will give out on me. So I need a cane or a walker to walk with. And so then you get to the point where like, I need to do something because I want my life back.
I want to be able to travel or
Yes.
play with grandchildren.
Yes,
or
absolutely.
Or just be able to walk in general.
Yeah.
I mean,
or kneel down and garden.
Yeah.
Little things that
Yeah.
you don't think about that you just want back.
So you all have a high level of certification and achievement, something you're obviously very proud of, as you
Yes.
should be.
Yes.
How much have you all had to train to get that certification and those recognitions? And what have you all been through?
It's definitely a team effort.
Yes.
Willis Knighton, I think, saw the value in a program like that, an advanced certification, and gave us the resources to be able to figure it all out, because
Right.
there's a list of standards and clinical practice guidelines and all of these things that you have to follow. But at the end of the day, it's truly a team effort. It took a team of all of us, our coordinators in place, but then also orthopedic surgeons, anesthesiologists, physical therapists, pharmacy, case managers. I was saying the other day, almost everyone you see in the hospital it took to be able to get us to where we are.
Yeah.
So, a team effort.
So Are there people that aren't candidates for joint replacement that you all say no to? Like they're too young or too old, or?
There are, in
Yeah.
cases, there
Yeah.
are. It depends.
Certain cases.
It depends. Some is maybe you have pain, but your arthritis is not progressed enough, and so it's just not time. You know, you've got to wait a little bit longer, and we'll try some of the conservative measures before we really jump into surgery.
You just, when you think it's premature, is there a minimum age that you all also treat?
No,
No.
well, 18 and older,
Yeah,
because we usually we do not do pediatrics.
Yeah, we don't do pediatrics.
But sometimes people in their 30s or 40s will have to have a hip replacement. It's not common, but the way that the femoral head develops and stuff, it doesn't develop right in childhood, and so they have to have a hip replacement into their 30s or 40s. So that's usually when we see younger people, something genetic. So.
All right, we'd like to remind people that you can call and ask questions of our joint replacement specialist here. That number on your screen is 318-219-4569. So please give us a call, tell us what your situation is, and get some advice from our experts while they are here. So, are people scared of joint replacements?
Yes.
Yeah, I would
Sometimes
say,
they are.
Yes.
I would say absolutely.
Yes. The majority, if not all, are scared of joint replacement surgery.
I feel like often people will come and say, I should have done this so long ago. I was just scared. I thought it was going to be this big thing. And it's a big surgery, yes. But one of the things that we like, we will be there with you. We truly will be. We're a phone call away at every point throughout the process. We have a joint camp that we do. It actually ends up being a weekly joint camp, because I do one in Bossier one week and then Jennifer does it the next week. And so that's a really great time for people who are having a joint replacement to come, and they can sit and you can talk to someone from your surgeon's office. You can talk to an anesthesiologist, a physical therapist, a pharmacist, a case manager, the people that you're going to see while, the day of, while you're having your surgery and everything. You can kind of get familiar with those faces, ask whatever questions you need. And so we try to take that fear aspect out of it, because a lot of fear is just not knowing. And we want you to be as educated about the process as you possibly can be.
How much has this procedure changed over the years?
Oh my gosh.
Has, because some people probably have stories that are 20 or 30 years old, experiences that people had, and that is contributing to their fear, and what they're going through with you all is completely different.
It is.
Yes.
Yes.
Absolutely. Yeah. I know 20, 30 years ago, you would be admitted to the hospital the day before, have your surgery, stay in bed in the hospital for 3 or 4 days afterwards, and then maybe start physical therapy and that kind of thing. That is absolutely not how it is anymore. Now with new technology and everything, you have your joint replacement done. In 4 hours, you're up and walking with a physical therapist. You can go home that day if you're stable and able to. And then a lot of our patients do actually go home the day of surgery, and if not, maybe the anesthesia needs to wear off. They'll sleep sleep it all off, and the next morning physical therapy comes, and off they go.
Wow. So if you get a joint replacement, is it going to last as long as you do, or is there some period at which you need to do something else again?
So generally, the research and studies have shown that the joint implants last 20 to 30 years. So so it just seems like that they'll last, and normally we don't have patients that come back and to have a what would be a revision to get another joint replacement.
All right,
to
well,
replace
we
that
have a
implant.
caller right now. Rena, what is your question for us?
I just got it answered. I wanted to know how many years does a hip replacement normally last?
That was perfect.
Yes, 20 to 30 years. Yes, ma'am.
And that's the newest research shows 20 to 30 years. So, and normally it's not the metal aspect of it or anything that you need to replace. It's just more of that wear and tear on the plastic. But 20 to 30 years.
Do you have any
Okay,
other
thank
questions
you.
for us? Are you wondering if you're a
Not
candidate?
right now. Oh, I've already had it. I just didn't know how long it would last.
Okay.
Okay.
Well, let's hope it lasts for you. Thank you so much, Rena, for calling.
Okay, bye.
Bye-bye. All right, so I think if you're, we have another caller. Excuse me, what's the name, please? Jim.
Jim.
Okay,
Yeah.
Jim, welcome to the program. What is your question about joint replacements?
I'm just wondering, for those patients that are not at that stage, but maybe they're experiencing a little bit of pain, what precautions or what protocol, what health things one can do to prevent falling into the situation where you have joint replacement? Does that make sense, the question? Is there anything you can do to
Absolutely.
reverse it, actually?
Yeah.
Not
Reverse, I don't know so much reverse.
Not reverse.
I think ease.
Slow down the process.
Yeah.
Yeah.
You certainly can. Low impact sports, walking is excellent as opposed to running. I know you hear that a lot, but it really is. If you're a little overweight, losing some weight can also help. But some of it really truly is just genetics. If someone in your family, your mom or your dad has had a joint replacement, it might be in your future. But low impact walking, things like that. If you do get, if it's your knee, if it gets swollen, take it easy, rest it, ice it, let it recover before you go back to it, kind of thing.
okay. Thank you.
All right, thank you so much for giving us a call. What should you, we have another caller. This is wonderful. Melvin, welcome to the program.
Hey.
Please ask your question.
Yes, I have a sciatic nerve, like runs from the right side of my back down my thigh, on down my knee, on down to my ankle.
Okay.
Okay, are you wondering what you need to be doing for it, if there's anything more you could be doing, and does that somehow qualify for what we're talking about here?
Yes, it's something I could be doing about it. Not with, well, at the age of almost 80 years old, I wouldn't think about surgery. I was wondering if anything could be done about it.
To prevent it.
Yeah. So have you seen a doctor for your sciatic nerve pain? Because there are interventions that they can take to help with it. Have you seen anybody or talked to anybody about it?
Yes, I had an MRI on the 27th, and I was supposed to go into Dr. Kieran, I think, on the 29th of this month
Okay.
for him to read my X-rays.
Yeah.
I had an MRI done.
Good.
Okay,
Okay.
yeah.
So you're taking
Yeah.
the right steps. And when you go, they'll get you situated. They may give you some medications. They may give you some injections. It'll just depend on what they see on your X-ray. But you're taking all the right steps.
All right, do you have any other questions for us?
No.
All right, well, good luck
good
to
luck
you.
to you.
We hope that your appointment goes well. And thank you for calling. Okay, so joint replacement, many of the people that you all take care of, I'm sure, are working.
Yes.
And so one of the big fears is, how long am I going to be out of work?
Yes.
And I'm sure it varies, but
It does.
I'm sure that's a big variable. What is the time frame that people are out?
It depends. Usually hips are a little bit easier to recover than knees, but like we said earlier, day of, you will be up and walking within 4 hours. You will likely go home that day. And then the first 2 weeks, you'll be at home. You'll receive, usually you get some kind of home health while you're there at home, and then you'll go back to your surgeon. You'll follow up with your surgeon. And the good thing is that we all are different. And so your surgeon is very willing to work with you and however you need. In those 2 weeks, look at your incision. How's that doing? Do you still need some home health? Are you ready for outpatient physical therapy? Where are you looking at? Most people, I've had some patients that take off 6 to 8 weeks of work and then they're right back at it. It really just depends. Some people it takes a full 12 weeks before they're really back to it. So, but usually, the first 2 weeks you're taking it slow, walking and at home and everything, and then by probably anywhere from 6 to 12 weeks, you can be back at it and working.
Yeah.
So you mentioned home health. Is that something people really need, or can a spouse play that role effectively?
So the home health would be the home health physical therapy. So the home health physical therapy will come out the day after your discharge from the hospital from your procedure. And then they will come and visit you at your home 2 to 3 times a week for 2 weeks. Then you go to your post-op appointment, and then that's when your doctor will assess how things are going, how well you've done, and then see if you need outpatient physical therapy. And then that can last from, depends on how well you progress with your outpatient physical therapy. And then you also get all your questions answered on how, after you're completed with your therapy, what's the next steps, how are you doing? And they can have outpatient physical therapy. They can last from 2 weeks. I've had some that have had it for 6 weeks after after your initial first 2 weeks.
Some people run from pain. Does it hurt?
Pain.
How do you safely manage the pain?
So, of course, each patient is different, especially on pain. But the pain from your procedure, it's a surgical pain. So it's a pain that will be, it's an onset of having your surgical procedure. But the more that you are walking and the more that you're putting in the effort of getting better and making sure that you're able to do the things that you're supposed to do, that pain ends up going away faster. Whereas the pain that you live with, your chronic pain, your arthritic pain, that's something that, it takes a long time, and it's a different pain as versus your surgical pain, which you will now have. It's a better pain. We always say it's a good pain, and that pain will eventually subside.
Instead of get worse.
Yes.
So when you come home, is there anything you have to do with your home to get it ready?
Safety is the biggest thing. We just want you pick up rugs to make sure, because you'll be on a walker. You'll have a 2-wheel walker for the first at least couple of days after surgery, and so navigating that around your house. Also, it's good to make a couple of meals, put them in the freezer before, because standing up long enough to make a meal is not necessarily something you want to do right after a joint replacement. So just safety, and to make it comfortable so that you can walk around right after surgery.
And animals as well.
Yes.
Animals are a big thing. As much as we love our pets, small or big animals, we need to make sure that they're out of the way, so it won't be a fall risk.
All right. Well, thank you all so much for joining us, and thank you to all of you for joining us for Healthline 3. Have a good afternoon.